I feel like it's bad because it'll stunt growth in the future.
I think weight training in youths is bad.
I do think pubescent weight training is bad because I believe that it stunts growth by causing damage to the joints.
Because I started lifting when I was in about 7th grade, and my doctor said that I was supposed to be about 6 feet or 6'1", and I'm only just barely 5'10" now.
All right, I do have experience with pubescent weight training as I began weight training around age 11 or 12.
Is resistance training before puberty good or bad for your overall health and growth? After asking others around campus, we observed that some people are all for it and some others are against it. To look into the opinions of the average person, we conducted a short survey around campus asking the same question: is resistance training before puberty good or bad for your overall health and growth? We selected, at random, 30 people and asked what their opinions were. Upon looking at the results of our survey, it can be concluded that most of these people had the opinion that pubescent weight training gives negative results. 55% believed that it was bad, 34% thought it was good, and 7% of the population believe there are positive and negative effects. Which of these groups are right? We decided to take a closer look to uncover if the beliefs on prepubescent resistance training are simply misconceptions or if the stereotypes hold true. During the 1970s and 1980s, one of the reasons that resistance training was not often recommended for children and adolescents was the presumed high risk of injury associated with this type of exercise. In part, the widespread fear of injury associated with youth resistance training during this era stemmed from data gathered by the National Electronic Injury Surveillance System of the U.S. Consumer Product Safety Commission.
One of the most common myths regarding weight training in children is the risk of inhibiting long-term growth. Many people have this belief that if a child weight trains too early, they will end up being shorter than their potential adult height. Although this is a common thought, there is no conclusive evidence or research that proves this idea. It is often argued that the short stature of some elite athletes is the result of their strenuous training, which typically involves weight training at a young age. Gymnasts are typically thought to have issues with delayed growth and skeletal maturity because of their short stature and intense training at young ages. Although gymnasts are typically shorter when compared to age-matched controls, research shows that these athletes are typically shorter due to selection bias, rather than physical growth being affected by their training. Also, studies have consistently shown that resistance training programs do not seem to have an impact on height or weight in pre-adolescence. In fact, only minimal changes in body composition of fat and muscle have been observed in healthy children.
Debatably, one of the biggest concerns about prepubescent resistance training is injury to the child's growth plate. Since the growth plates do not fully close until puberty, the general concern among people is that if a child were to injure one of these areas containing a growth plate, that it could disrupt growth. Now, while this is a possibility, only around 15% of all growth plate injuries result in a growth disturbance. If the injury were to be left untreated, it could result in a permanent growth disruption such as length discrepancy and angular deformity in bones or even altered joint mechanics. These growth disruptions are usually avoided if medical attention is sought soon after the child's injury occurs. A specific time to be cautious of these injuries, and growth plate injuries specifically, is while the child is in puberty. This is due to the lack of coordination in the child at this time with the rapid growth of their body. Now, with all of this being said, resistance training is found to be no more dangerous than other children's sports if done properly. It may even be debatably safer than other organized contact sports because there is more predictability with the set movements required in resistance training.
A traditional area of concern related to youth resistance training is the potential for training-induced damage to the growth cartilage, which is found at 3 main sites in the growing child's body: the growth plates near the ends of the long bones, the cartilage lining the joint surfaces, which is the articular cartilage, and the points at which the major tendons attach to the bones, the epiphysis. However, it was found that although children and adolescents are susceptible to injury to the growth cartilage, the potential for this type of injury may be less in a pre-adolescent child than in an adolescent, because the growth cartilage may actually be stronger and more resistant to shearing type forces in younger children. Another area for concern for adolescents' weight training is them loading too much weight and improper lifting techniques. This could lead to injuries that would not happen if properly trained and supervised. Some of the most common areas for injury whilst unsupervised for adolescents is the hands, feet, and head. However, this can all be prevented. When giving proper supervision and appropriate program design, young athletes participating in resistance training can increase muscular strength and do not appear to be at any greater risk of injury than young athletes who do not undergo such training. In a prospective study published in Sports-Related Injuries in School-Aged Children, they evaluated the incidence of sports-related injuries in school-aged youth over a 1-year period. Resistance training resulted in 0.7% of 1,576 injuries, whereas football, basketball, and soccer resulted in approximately 19, 15, and 2% respectively of all injuries. When the data were evaluated in terms of injury to participant ratio in school team sports, football 28%, wrestling 16.4%, and gymnastics 13% were at the top of the list.
Another main concern that we must discuss is how coordination develops. As you may already know, young children can be quite uncoordinated. Given that weightlifting can be difficult enough, allowing a child who may not yet be as coordinated as another participant in certain exercises would show an increased risk of injury. Coordination, defined as the use of agonist and antagonist muscles working together in relation to the nervous system, giving one the sense of balance, spatial awareness, and reaction time, does not mature until age 7 or 8 and up to 14 years old. This is an important factor in regards to motor and neural development that one must consider before starting resistance training as a young child. It has also been shown that because weightlifting movements involve more complex neural activation patterns than other resistant exercises, childhood is the ideal time to start the development of coordination and skill technique to perform these lifts correctly. On a more positive note, weight training has been shown to increase these coordination skills. Even though you may not see a great extent of gains in muscular growth, there are neurological adaptations which are a large benefit that come with weight training. The resistance challenges the neuromuscular system, resulting in recruitment of more motor neurons and further advancing the connections. In a study conducted by Ramsey et al. In Strength Training Effects in Prepubescent Boys, motor unit activation increased 9% in elbow flexor muscles and 12% in knee extensor muscles, and showed an advancement in coordination, therefore showing an increase in strength in children following 10 weeks of weight resistance training, thus showing neuromuscular coordination is significantly more efficient after strength training.
One of the reasons that people lift weights is to get stronger and enhance performance in designated sports and activities. With today's athletic society getting stronger and better every day by breaking records and setting the bar even higher, it comes as no surprise that weight training starts in pre-adolescence. It has been found that weight training and resistance training have enhanced pre-adolescents' athletic ability. Improvements in selected motor performance skills, for example, the long jump, vertical jump, sprint speed, and medicine ball toss, have been observed in children and pre-adolescents after resistance training with weight machines, free weights, body weight strength exercises, and medicine balls. There have also been other studies that have reported significant gains in strength without associated improvements in selected motor performance skills after several weeks of resistance training. Because the effects of the resistance training on motor performance are dependent on the design of the training program, it is important to consider the specific training used when viewing this data. The greatest improvements in motor skill performance included attention to age-specific training and the types of muscle actions used in the manner that is specific for which training is being performed. Although the potential for resistance training to enhance the sports performance of young athletes seems reasonable, scientific evaluations of this observation are difficult because athletic performance is such a multivariate outcome. It should also be mentioned that to date, there have not been any long-term investigations studying the effects of a comprehensive youth resistance training program on sports performance during the adult years.
Most of the physical health benefits that come with resistance training may seem obvious, but what is also found with an increased physical activity is increased brain function and mental performance. This is largely due to an increase in blood flow throughout the body, including the brain. An increase of blood flow to the brain is shown to improve mental proficiency and speed. Self-esteem is also known to increase directly after physical activity such as weight training because of the release of endorphins in the brain. Endorphins are a chemical produced by our brains that create feelings of pleasure and euphoria. Self-esteem can also improve in children that increase their knowledge, skill, or strength in resistance training. A multitude of studies from groups such as Columbia University, the New York City Health Department and Department of Education, and the universities of Illinois, West Virginia, and California have research showing the positive correlation between the amount of physical activity children get and their grade performance specifically.
Pre-adolescent weight training has been shown to be very beneficial for a child's overall health when performed correctly and under direct supervision. It has been reported to positively affect the bone mineral density, cardiorespiratory fitness, and resting blood pressure of children over time with gradual training progression. A study done by the College of New Jersey have shown that over time, children are effectively able to improve their blood lipid profile by lowering their LDL cholesterol and increasing their HDL cholesterol. This can have long-term positive effects, lowering the chance of having heart disease in adulthood. Resistance training has also been shown to be beneficial for improving overall body composition in obese children and adolescents by lowering body fat. While children at healthy body weights do not see significant changes in body composition, they still see the positive overall health benefits. Resistance training in adolescents is currently used in rehabilitation settings since it has proved to be beneficial for children with certain disorders that impair growth, such as cystic fibrosis, osteopenia, and cerebral palsy. Resistance training is being prescribed to help treat children with cystic fibrosis with pulmonary exuberation by improving lung function, leg muscle strength, and overall body composition. Children with cerebral palsy see increases in muscular strength and improvements in daily activities and overall quality of life when using strength training programs. Resistance training programs are also regularly used when treating children with major burns on their body. One study showed that children with burns over 40% of their body who were prescribed with resistance training programs saw significant benefits. These children saw increases in muscle strength and improved body composition, while children who were not prescribed with resistance training programs saw a loss of strength during recovery. While resistance training programs for pre-adolescents is beneficial for increasing muscular strength, it is important to note that young children do not typically undergo hypertrophy. Even though there is no significant increase in muscular fiber size, studies show that strength gains in pre-adolescent children are comparable to adolescents and adult strength gains. While strength training programs may not increase the size of muscles in children, it can lead to changes in fiber type and neurological adaptations that increase overall strength. Strength training before puberty is also known to enhance muscular growth and enlargement during puberty in both males and females.
When it comes to bone health, weight-bearing exercise is essential to proper bone growth and correct formation in children. Resistance provides that necessary dose weight-bearing exercise. Early bone growth is important in young children in order to obtain a maximum bone mass density. It is especially vital to secure this maximum bone mass density while young, since growth of the bone mass density peaks around 20 years of age. As soon as one passes this peak bone mass density, it proceeds to drop off at a steady rate for the remainder of their life, with little to no potential of further increasing this number. This imposes a risk of bone fractures as you age. This risk of bone fractures is crucial to the health of women. Women, compared to men, have a much higher risk of fractures than men do, simply due to the lack of testosterone. This eventually results in osteoporosis, a chronic condition which bones become weak and brittle, a disease which costs the U.S. healthcare $5 to $10 billion and is the cause of 1.5 million fractures annually. What if we had the option to prevent this? Studies show that with the addition of proper nutrients, participating in a youth resistance training program shows a maximized bone mass density during childhood and adolescence, well above the normal recommended levels. It has been researched that along with the enhancement of bone mass density, there is no detrimental effect of resistance training on growth and development of bones in children and adolescents, thus showing how vital weight training can be in maintaining a healthy bone mass while greatly reducing the risk of bone fractures, osteoporosis, and other debilitating diseases related to the health of bone.
All right, my name is Grant Tompkinson and I am an Associate Professor here in Kinesiology at UND.
Can you explain why you are an authority on this topic and your background?
Absolutely. So I have a bachelor's degree in sports science, majoring in exercise science. I also have a master's degree in human movement and a doctorate in human movement. And for my doctorate, my focus was on children's physical fitness, which had a focus on aerobic fitness, but muscular fitness. And I've published widely on these topics, presented at conferences on the topic of strength and aerobic performance in kids. So I feel I know a little bit about the topic.
So what are some risks that you know of prepubescent weight training?
I think the first thing to say is that resistance training in kids is a safe exercise if done correctly, particularly if done in a supervised environment. If you're a child and you're able or willing to play any form of sport, recreational sport, school sport, club-based sport, then you are at the age, the appropriate age developmentally, to start resistance training. So if done in a proper supervised environment and you follow the right steps with an accredited individual, it can be a very safe form of exercise and no riskier than any other form of youth sport.
So you would say that there are no risks that come with prepubescent weight training then?
I'm not saying there are no risks, but the risks are no greater than what you would find in typical sport. So of course there are some risks, but there are also some misconceptions attached to those risks. So for example, some people believe that you are going to stunt a child's growth if you perform resistance training, but there is simply no good evidence that indicates that you get a premature closing of any of the growth plates, that you stunt a child's growth. And we know that there are a whole stack of benefits. So while we're typically a risk-averse society and we focus on those risks, if we do it in a proper supervised environment, so for prepubescence, we try not to load the spine, particularly because the spine is not a weight-bearing column. We try to work on getting form and focusing on skill acquisition early and build through strength in the skill and focus on developing size and strength later on, then the risks are minimized. But if you're doing it in a very loose way, in an unsupervised environment, then the risks will increase.
So you mentioned benefits. What were these main benefits of prepubescent weight training?
So there are a stack of benefits. We know that it improves the strength or the health of your muscles and also your bones. We also know that resistance training has knock-on benefits to the health of your heart or your cardiovascular system. Beyond that, we know that resistance training is very good for your mental health. It increases your self-esteem, your self-confidence. We know that kids who perform resistance training also perform better academically. So it improves cognitive performance and they're better able to perform in the classroom. We also know there are socialisation benefits. So we know kids are better socially, they integrate better with their peers, they have better friends networks, it stretches those networks. And we also know there's reduced absenteeism in school associated with resistance training. So if they're happier, if they're healthier, these are all good benefits associated with resistance training.
Okay, so earlier you mentioned the misconceptions and myths about prepubescent weight training. What are your thoughts on these?
Yeah, there are a number, and I'm trying to give you evidence-informed decisions here. So the first one is that it stunts your growth. As I mentioned before, there is no good evidence that resistance training, if done properly, stunts your growth. The second thing is that some people believe that resistance training is only the domain of youth athletes, and that if you're not athletically predisposed, then it's not something for you. This is completely incorrect. Resistance training is appropriate for kids of all ages, and it helps with their healthy growth, development, and well-being. There's also a misconception that it leads to bulky muscles, particularly in girls, that if girls resistance train, they get this bulky effect and start to look like boys. What we're seeing here with girls, if done properly, we get good neuromuscular facilitation, they improve their skill acquisition, they're more likely to try and increase their repertoire of physical activities and perform other activities. So it bodes well for their physical activity participation, not only in adolescence, but also lifelong. So while there are a number of misconceptions around it, resistance training has been shown to be a safe and beneficial exercise modality for youth individuals.
So considering the benefits and the risks, what would be your main recommendations with weightlifting?
I think weightlifting or resistance training is very beneficial. And now while there are risks, what we need to do is we need to try to optimize the benefits and minimize the risks. So when we prescribe exercise, it's just like prescribing a drug. There are always benefits and risks attached to it. So we need to try and find the appropriate dose for the individuals at hand. So for kids, they should focus on the process. And by process, I'm talking about the acronym PROCESS. So P, first off, it needs to be progressive. It needs to be progressively harder over time. The second thing they need to focus on is regularity. So they need to do it frequently. The third thing is you need to focus on the O, or the overload. So it needs to be harder than what it was beforehand. You then need to focus on the C, or the creativity. So they need to be creative in the gym, not just doing the same things over time, which will lead to very stale progressions. The third thing is E. The next thing we should say is E. They need to focus on enjoyment. They need to have fun while in there. And the two S's, supervised and also socialization. They need to do it in a supervised environment, but also need to socially engage with their peers, their friends, their teammates in order to get the benefits. So if we can maximize the benefits and minimize the risks, I would say go for it. It can be a very good exercise that not only improves the health and performance of kids today, but also tomorrow.
There is no specific research giving a time frame in one's life to start resistance training as a child, but we can say that if we take into consideration the age someone begins to develop their coordination skills, we can come to conclusion with our own recommendation of when to start. Knowing that coordination, such as balance and postural control, develop until around 7 or 8 years old and up until 13 years old, beginning strength training before this age is advised. We would recommend that children wait until these skills have properly matured and evaluated by a pediatrician in order to further avoid injury. Also, we recommend that upon starting, children should adopt a minimal routine that shows resistance but also is not too strenuous or difficult for the child's coordination level. As one shows increased proficiency in coordination skills, the child can make advancements in small increments, according to their supervisor. For planning a resistance training program, the 3 factors to consider are the specific type of resistance training, frequency, and volume. The only specific type of resistance training style that have not been recommended for children is Olympic style lifting due to the immense amount of coordination involved and the risk of injury. As for frequency of the program, or in other words, the amount that the child should be lifting a week, the recommendation is about 2 to 3 days a week on non-consecutive days. The volume in each workout should be around 6 to 12 exercises with 1 to 4 sets, and each set containing anywhere from 6 to 20 repetitions. These programs may be intensified over time, but should only be done so when a certified trainer believes it is okay to do so. Basic education on weight room etiquette, proper exercise technique, individual goals, and realistic outcomes should also be a part of the youth resistance training programs. All participants should receive instruction on safety concerns, including the correct use of collars, appropriate spotting procedures, the proper storage of exercise equipment, the appropriate handling of barbells, dumbbells, and plates, and sensible starting weights. This is particularly important for untrained children who often overestimate their physical abilities. Our final and most important recommendation would be for proper technique and supervision. Instructions and supervision should be provided by qualified adults who have had an understanding of youth resistance training guidelines and who are knowledgeable of the physical and psychosocial uniqueness of children and adolescents.
So, do you believe it? With the evidence from the research that we've presented in this documentary, it should leave you with no doubt that prepubescent weight training is most definitely okay and even highly encouraged. We've heard all the myths, including stunting growth and development, harming joints and muscles, risk of injury, especially to the growth plate, and girls getting big, bulky, and psychological stress put on the child. But after learning the facts from sifting through a lot of research and hearing from an expert, we are left with the fact that these misconceptions are just that, misconceptions.
If you want to be muscle, you have to work out, you have to build up. You gotta go down, look. Strength, no weakness. You don't do weakness.